Now, every year, nearly 59,000 people die from rabies worldwide, with over 40% of victims under the age of 15, according to the World Health Organization. Nigeria accounts for thousands of these deaths annually, with most traced to dog bites in communities where vaccination rates remain alarmingly low. Now, rabies is 100% preventable, yet it continues to kill, making it one of the deadliest but most neglected diseases in our public health system. Now, the implications, they go beyond health. Families are left devastated, communities face economic cost of treatment and loss of productivity, and mistrust grows when government campaigns fail to reach rural areas. In Nigeria, where over 70% of dogs are unvaccinated, the disease threatens both human life and livelihoods, putting pressure on fragile healthcare systems.
In past campaigns have been sporadic, underfunded, or poorly coordinated, leaving gaps in vaccination drives and public education. While NAFDAC and veterinary groups push awareness, experts say rabies control demands stronger enforcement, community buy-in, and sustained investment. Globally, the WHO and partners have set a 2030 target to end human deaths from dog-mediated rabies. But achieving that in Nigeria requires far more urgency.
Indeed, it does. Joining us now is Dr. Ofua Mark, Chairman, Nigerian Veterinary Medical Association, Lagos State Chapter, to help unpack this further.
Good morning,
Dr. Ofua, you're welcome.
Good morning.
Thank you very much for joining us. While we were reading, I could see you going, yeah.
We agree.
Yeah.
We agree.
Yeah, exactly. So it's very interesting because it's been a while since I actually heard plenty of attention on rabies in Nigeria. Growing up in the 80s, it was like on everybody's tongue.
Yeah.
You know, don't let a dog bite you because, you know. So I'm wondering how far we've come from the 80s up until now. Have we seen a decline in the attention that's given to the disease? Noting how, I don't know how people treat their animals these days, if it still has the same, if they still have the same concern as they used to back in the days.
Okay, so going back in time, the hue and cry from Nigeria was in tandem with the global hue and cry. And then there was a global response, and then countries that were serious have been able to kick out rabies. Eradicated from their countries. But Nigeria, with lip service being paid and the right thing not done, rabies sadly became what we call an NTD, a neglected tropical disease, because it's usually seen in the hinterlands, in the rural communities, local communities around the metropole. You understand? So little attention is paid to it. You hardly find somebody in the city center, the elites, you know, contracting rabies. So because of that, it thrives. It's endemic in Nigeria, actually. You know, it thrives, and then there's little attention.
Could you explain endemic now?
Endemic, that means it's there. It's there. It's, you know, it's there to stay, sadly. You know, little attention is paid to it. It is underdiagnosed. I mean, a child contracts rabies, they say it's evil spirit because of the, you know, when the disease begins to show, the manifestation is nervous. And then the child starts convulsing, and instead of taking the child to the hospital or something, they bind evil spirits and all that. And then because of that, the child dies because rabies is fatal.
Yeah.
And that case is not reported. So it's there, it's not reported, and we need to work. I am very grateful for this team's World Rabies Day, which is act now, you, me, community. Everybody would have to act now to meet that 2030 target of eradicating rabies.
Wow.
Right.
Interesting.
So, you know, this is so funny because I wanted to ask, do you think we have to get to a point where people will really have to apply before having an animal? Because I feel like having to get an animal and then they don't have proper treatments, which also means endangering yourself, you know, in Nigeria. Do you think it's something that they have to consider so that way we can reduce or eradicate rabies entirely?
Absolutely. Now, people get dogs for different reasons. I saw it in the movie. My friend has a dog. I think it's cute and all that. But they do not get a requisite knowledge that should go with owning a dog. For example, rabies vaccination is not something you do because you feel like it. It's a law, actually. You should do it. If you
Doesn't
have a
that
dog.
go with owning a dog and licensing it? In the 80s, you needed to license your dog.
Absolutely,
Now,
yes.
is your dog licensed?
Yes.
And then, not even beyond that, we now have a proliferation of quacks in the space. And that is a huge problem because these guys are not educated on how to handle these vaccines, on how to handle the dogs, you know. And then some vaccines are actually what we call live culture, live vaccines. So if you mishandle a live vaccine, you are actually going to give the dog rabies instead of preventing rabies.
Because the vaccines are live rabies.
So it's only
themselves.
somebody who has been educated on how to handle them that can handle them correctly. You know, so there are so many factors in place, and what you just suggested is a very good solution. You know, before you own a dog, get a license. But that now leaves, and that's another reason why rabies thrives in the rural communities.
Right.
How about the stray dogs? Who is going to vaccinate them? That is a huge challenge.
Is there an apparatus on ground to do that, vaccinate stray dogs, and how's that going if there is one?
So currently, the NVMA, the association I represent, we're working. We have veterinarians, and this is very, very beautiful to behold. Veterinarians who say, oh, you know what, I'll take from my pocket, you know, to fund to help with the problem. So we have free rabies vaccination going on, funded by members of the NVMA. We also collaborate with the government to do free rabies vaccination. So we go to these communities and we say, oh, don't worry, don't pay. Just come. In fact, we even give them incentives. You know, come and you get a gift for your dog or for yourself or something.
Dr. Ofua, let me ask, I mean, which one is better? I mean, if you're going to spend all that money vaccinating these dogs, they're stray anyway, why not just put them down? Empathy?
Yes, so when you talk about taking dogs off the streets and putting them down.
She's angry with me because I said put them down.
Empathy is a huge one. I'm telling you, the hue and cry will be international. There was a time a dog was killed in an estate in Lagos, Cooperative Villas.
I remember that story.
Yes.
I got calls from the US. I got calls from UK. I got calls. What's going on in your country? I'm telling you, it was international. So such a thing, yes, there's empathy. But if you also look, these stray dogs, stray animals, they have a role they play. Do you understand?
Interesting.
Yes, they keep setting rodents and wild populations down. So you really don't want to eradicate them because of the backlash and all. So what we say is, yes, the people love them. Some of them are owned, but for example,
Free range.
the owner stays in. I've seen such a place where I went to work and I ended up dropping money instead of collecting money for my services because the owner lived in a one-room apartment with the entire family. So the dog had to be.
Awesome.
Do you understand? So you get all that.
Then that's a case for the licensing issue. I mean, if you're going to own an animal, you should be able to take care of it properly, make sure that it's properly vaccinated, make sure that its well-being is also attended to. But in Nigeria, we simply just get a dog for security. Why do you have a dog, for instance?
For love.
Which is why, and that's the point. So this is what I'm saying. I have a dog for love as well, and I take care of it.
Yeah.
But when you have a dog for watch over me and my motorcycle that I parked outside, it becomes like, it's just a... So don't we need that focus on documentation when it comes to
Absolutely.
animals?
I would say we're a work in progress. So over the years, we have people who had dogs just because security, breeding, you know, and all that. But we are transiting into people. I mean, I'm sitting with two people who have dogs for the companionship. So that tells you that there's a transition going on, you know, and it's beautiful. Then also, let me quickly say this. When we talk about rabies, dogs are most implicated. In fact, people think dogs have rabies. Then you now have to prevent it getting to you. That's not true. Rabies is a disease, it's a viral disease. Preventable, 100% preventable. That's the painful thing about rabies. It's 100% preventable. It's a viral disease of warm-blooded animals. So really, warm-blooded animals can contract rabies. Your goats, your cows,
No.
you know, your bats and all that.
I was about to ask, but thank you for bringing
But why
it up.
dogs are mostly implicated is, yes, they're closest to us. So you have rabies endemic in wild animals, you know, but they're far from us. I don't hug monkeys every day or something. You know.
What exactly is rabies? Now, we all know what the end result is. hydrophobia,
Yes.
where people
Those are
can't,
when you begin to see the signs.
and
yes.
that's when you can't turn back.
Oh, yes.
It becomes
yes.
fatal then. But what exactly is it? What kind of a virus is it?
So it's a Lassa virus. It's a
virus.
viral disease of warm-blooded animals. Like I said, it's transmitted through saliva. It's carried in the saliva, transmitted through bite and scratch. Okay. So now vaccination prevents it 100%. But the sad thing about rabies, and I think that's also the terrible thing about it, is once rabies takes root, curing is almost impossible. So the patient would almost always die.
Wow.
Once it takes root.
Yes, I think in the history of the world, there's just been one person who survived rabies bite.
So when you say it takes root, so from the point of being beaten or scratched,
Being exposure, yes.
how can they be saved? Is there a time frame?
Yes. Oh, yes.
From what time
Beautifully,
to what
yes.
time?
So once there is a bite or a scratch from a suspected animal, a suspected animal now is an animal that has not been vaccinated
Right.
or is not owned or the medical history is shady. Quickly run to the tap, wash the place with soap, detergent, under running water. You know it's carried in saliva, so get rid of the saliva as much as is possible. If the place is bleeding, don't wrap it. Encourage it to bleed because that helps to flush it from the inside.
Okay.
And then when you do that, after that, go to a hospital immediately, a health center or something. There's what we call post-exposure treatment that you would get. Quickly, it's expensive, which is another problem. So we're also calling on the government to subsidize the treatment. It's expensive. You need to get series of injections within a short period of time, immunoglobulins and everything, but it can be saved. So the danger now, and children are usually the most exposed, is when there is a bite and it's not treated. Until you now start feeling the child maybe having fever and then feeling pains or something, and then you go to the hospital.
Continue with the symptoms. Fever, pains, and then
yes. General pains, headache, confusion. That is the beginning. And that is when they usually go to the hospital. But then it progresses because it attacks.
Is it too late by then?
Oh, yes, it's already becoming too late. Once it's showing symptoms, it's already becoming too late because it has hit the nerves. That's why you're seeing symptoms. And then you see that thing when they say the person begins to bark like a dog. So rabies actually, it affects the nerves. And then we begin to have what's called paralysis, descending paralysis. So by the time the paralysis gets to the muscles that controls the box, the person tries to talk, it brings out very weird sounds that looks like barking. And then there's hydrophobia, there's aerophobia, there is,
Hydrophobia is
fear of water.
Fear of water, aerophobia.
Breeze, wind, and then they just go into seizures when breeze blows on them. Even loud sounds, all these can trigger the seizures. But by then, it's already too late. The person would almost certainly die.
Interesting. So I think my question now is clearly having a pet is pretty expensive. Sometime a few months ago, India talked about, finding a way to reduce stray dogs in their community. And in as much as it's good for people to have their right to buy pets and everything, do you think when you go to these communities, your organization go to these communities to help them, give these stray dogs free vaccination, and then you leave them back there? How often do you think you can keep going there? Because now they're still exposed to, sleeping outside, playing in the dirt. There's no much cleanliness because I'm sure they're not registered to a vet. So how are you going to prevent them from having recurring issues?
So the key is education. If people know they want to do better, I have seen it happen. Most people don't know. In fact, I have seen somebody, an educated woman in VGC, Lagos. She brought a puppy to me and the puppy was so skinny. She had owned the puppy for like 2 weeks. I'm like, what do you feed the puppy? She was like, feed? She didn't know she had to feed the puppy.
Oh, really?
She just bought the dog and kept it in the backyard.
Or they run on solar power.
Yes, or they eat grass or something. She didn't know. And honestly, when she saw my shock and
that's silly.
The dog should be eating 3 times a day, she broke down in tears.
I need to talk to her.
She broke down in tears and she was crying, so she didn't know.
Aww.
So when people know, they do better. So when we take this education to them, which is what we're doing on campaigns, we're going to schools right now, different schools in Lagos State, we're preaching the message because children, if you want a message to get to adults, tell it to children. It sticks,
Right.
So we're going to campaigns, we're doing all this to ensure that the message goes round.
Right. So now this rabies, sorry, Mazino, I know you want to. So the rabies vaccination, is it once or how often do they take the vaccination? Because I know that I think every 3 months my dog take Bravecto and all what dogs are expensive. But how often do they need this vaccination?
Yeah. So in countries where they don't have rabies, it's actually once in 3 years. But because it's endemic in Nigeria, the law says every year. So every year you should, and that's why we do our campaign every year.
Right.
So you should take rabies. The dog should be vaccinated every year by a qualified veterinarian.
Right. So now not those dogs, other animals that you keep as pets.
Oh yes, every animal. Yes. Oh yes.
As long as it's a mammal.
Yes, as long as a mammal, warm-blooded, you should talk to your vet about rabies vaccination.
I used to have pet goat when I was a baby.
You used to have pet goats?
Yes.
Did you guys eat it at Christmas? It's not
That's not a You have a farm.
You farmed it. So we're talking about vaccination for these animals. What about vaccination for humans? And also, while you're doing that, also tell us the procedure when it comes to treatment. I hear it's a very interesting one.
Yeah, so vaccination to humans, there are humans that we call at risk. So veterinarians, zoo workers, wildlife experts, they're at risk. So those guys can actually take a vaccine that prevents. And the vaccine,
Are you vaccinated?
Oh yes, I don't joke with it. I mean, I work with wild animals. I'm a
when you say
wildlife
wild,
veterinarian.
please don't tell me snakes.
Oh yes, I'm the snake man of Lagos. You can Google it. I almost brought my snake today. So yes, there is that vaccine that we take that protects us. I think it's about every 5 years we do that. And then, but aside that, when there is now a bite, we now do what is called post-exposure prophylaxis. It's not interesting, I'm telling you. You take several injections, about 4 or 5 injections in a short while, you know. You have to.
And I hear the bore of those needles at this thick.
It's huge, yes.
Why do they have to be that thick?
Oh, well.
And where does the injection go?
Deep into your muscle.
Why are you so...
Yes, like you had it before.
I've seen these syringes. They're huge. And I had a friend who got treated for it once.
Yeah.
And she said she got stabbed in the stomach.
Oh, wow.
Multiple times.
So we, as veterinarians, we are not trained and licensed to treat humans.
Okay.
So even though I have the vaccine, the post-exposure treatment, I will tell you, go to a hospital. So if the doctor decides to inject you anywhere, that's not my...
Very interesting. Let's talk about India. Yeah, you raised India and compare the situation there. I don't know if you have stats to compare when it comes to how they've dealt with the situation there and Nigeria. We don't hear about people infected with rabies in Nigeria, but you as the doctor, as the expert here, you're telling us that we do have that concern, we have that risk if it's not a concern. So if you compare Nigeria to India, how are we doing when it comes to the global fight against rabies?
You heard about the recent cleanup in India and even how it's caused some concerns and all. These are countries that are not ashamed to own up to the problems they have. And that is one step towards fixing it, you know. So they have statistics because they own up to it, you know, and then they fix it. But in Nigeria, it's neglected. Rabies is neglected. I can tell you that. Was it last month or 2 months? We did last month or so, yes. We isolated the rabies virus from a dog in Aja, Lagos State. It was in the papers. We reported it, you know, and it had to be from the private sector. And then we went out and we screamed it loud. Look, there is rabies here. And thankfully, we have a government that listens. You know, the Ministry of Agri, they came out. And right now, as I tell you, those communities have been targeted. Because when you have one, just imagine.
There will be others.
Yeah, so we've targeted these communities to do the free rabies campaign for them.
Is it true? Now, I know you said it's endemic and it will always be here with us. But is it true that dogs, especially, or bats, actually possess or produce it like venom, that they do not need to, it's not a vector system, it's just in them?
It is not true.
So it is not true.
It's a vector system.
It is a vector. Okay.
Yes, so a dog bite does not automatically translate to rabies infection.
Okay.
You understand? The dog has to be infected.
Okay. Right.
And then come down. For example, if a rabid animal bites a dog that's been vaccinated for rabies, the dog won't contract it. The dog has to be vulnerable to contract it and then give to a human.
Does it manifest the same in dogs as in humans?
Yes, similar.
Hydrophobia, aerophobia, everything.
Very, very similar. We have two forms of it. the dumb form and the furious form. The dumb form, the animal is calm, just staring in space, drooling saliva and all that. The furious form is what we're used to. The animal is mad and charges at anything. Yes, but those are the two manifestations.
Interesting.
Wow, Dr. Mark.
So please, for World Rabies Day, ensure your animals are vaccinated. Ensure your neighbor's dogs are vaccinated.
Yes.
And animals around. Yes.
It's
not expensive, is it?
Ensure. It's not expensive. It's not expensive. And then there's the free campaign also. It's all over Lagos. So if you think you don't have the money, take advantage of it.
Where do we go? Because I would like to take advantage.
Well, just any local government office around you.
Okay.
They have the agric sector.
Oh.
So when you go there and ask, they will point you, give you the pointers.
They do?
Oh yes, they do.
Really?
They do. That's it.
We need to take advantage.
I mean, we don't know about these things. This is my point. I mean, I didn't know that your local government area had council had an agric sector, and I could get the injections from there.
Oh yes, you can go there and they'll direct you.
I'm going to check that out. Dr. Mark Ofua, thank you very much. It's been a
Dr.
very,
Mark.
very revealing session here.
Thank you very much.
I would have thought that some conversation about animals was going to be this exciting.
It was.
It absolutely was. Thank you very much. Thanks for coming.
Don't worry, you get to see Mochi someday.